My name is Amy Osbahr. I've been an occupational therapist for 20 years, since 2004.
Occupational therapy is a specialized service that we provide for individuals of all ages to help them participate in their daily routines.
There are a lot of diagnoses that can benefit from occupational therapy. We treat kids with developmental delays, autism, fine motor, gross motor coordination deficits.
We work on a lot of different things from head control to trunk control.
Making sure that they're rolling over at appropriate times, working on sitting balance, transitioning to standing.
As they progress with those skills, then we might work on crawling and kneeling, teaching them how to hit those age-related milestones. And that way they can build on those skills to be able to participate better in play and school activities.
Your school-age kids work with handwriting, attention to task, to transition from one activity to the next. Bilateral hand skills and crossing midline.
Young adults that might have had a fracture or an injury at work, or strains, surgical repairs, amputations, cardiac episodes, and we need to work on some balance, strength, and endurance.
People that have had brain injuries and spinal cord injuries.
So we're working on learning a lot of new skills. We're teaching adaptive ways, that way they can be more independent with their routines.
We work with individuals that have had joint replacements, that have had injuries to hands, wrists, elbows, shoulders, letting them regain strength and function back to that upper extremity so they can get back to school, work, or play.
People that have decreased mobility, and we might need to work on assistive devices or adaptive equipment, fall prevention.
Decreasing their falls, being able to maintain being in their home longer.
We have a fall prevention program and protocols that we follow. So I see a lot of balance patients. People who have increased swelling, so maybe some lymphedema management.
We do manual fluid mobilization to help move that fluid out of the affected limb. And then we are able to use low stretch lymphedema wraps to apply compression to help keep that fluid from returning. We work with individuals that have Parkinson's. I am trained in the LSVT program, so we work on a lot of big movements, getting them to be able to transfer and dress and do a lot of things back in their lives. We work with vertigo patients.
Stroke patients. I do ergonomics and workstation assessments and wheelchair assessments.
Occupational therapy is always individual based.
So based on their learning speed and learning ability and their functional capabilities, we come up with a plan for OT, PT, and speech as well. We all try to work together.
I speak with patients, with family members to figure out what their goals are that they want to reach. So when we develop that skilled plan of care, we are able to encompass every aspect of that individual's lives for what goals they want to accomplish. We want them to maintain that highest level of function with their daily routines, whether it's returning to play cards or learning to tie shoes or getting your golf swing back. All of those are big moments for people in their lives that need help with regaining skill.
She is very good at what she does, and she's just a delight to work with. You know, very personable and just great to work with, you know, but yet she gets the point across.
If you or any of your loved ones need therapy services, please contact us at Manning Regional Healthcare Center.
Manning Regional Healthcare Center, your trusted experts close to home.